Hi guys, how are you? I hope you are all well. Uh, Today's my topic of discussion is about the occipital lobe, its boundaries and its functional anatomy. Okay, this is the last part of your brain. I fairly talk about the telencephalon. Okay, if I talk about the telencephalon, so these are all the cerebral cortex of the brain. So these are all included, made from the telencephalon. Okay, first I draw the structure of the brain. This is the central sulcus of the brain, this is parieto-occipital sulcus of brain, and this is lateral sulcus of the brain. So today's my topic of concern is about this area, which is the occipital lobe and its boundaries and its functional anatomy. First I tell you the boundaries of the occipital lobe. I label it with blue. Anterior and little bit superior to the occipital lobe, this is the sulcus. Okay, what is this sulcus? Number one, this is the parieto-occipital sulcus, which form the superior and anterior boundary of the occipital lobe. Okay, and a little bit I move here in yellow color. Here is the pre-occipital notch. Okay, here is the pre-occipital notch. I marked in this color. Here is the pre-occipital notch. I draw the imaginary line. Okay, so this imaginary line which cross the pre-occipital sulcus, number 2 is the pre-occipital sulcus. I draw the imaginary line which cross the lateral sulcus and the pre-occipital notch. So this is the border of the occipital lobe. So there are two boundaries. First one is the parieto-occipital sulcus. Second one is the imaginary line which cross the lateral sulcus and pre-occipital notch. And inferiorly and posteriorly there is a boundary which formed by the occipital bone. So number 3 is the occipital bone. Okay guys, these are all the boundaries. This is the occipital lobe. Okay, which I draw here, three parts, three boundaries. Okay, now I tell you the functional anatomy of the occipital lobe. So this is our brain. This is parieto-occipital sulcus, anterior and superior boundary. This is lateral central sulcus, and this is lateral sulcus. Okay, so I draw the borders also. This is the imaginary line. Okay, so the just posterior to the parieto-occipital sulcus and just a little bit posterior to parieto-occipital sulcus, near to the occipital bone, there are two areas. Okay, so the first area, which is primary visual cortex. Okay, the first area is what is the primary visual cortex. This is about, if I talk about the function of this, it's about the conscious awareness of visual stimuli. Okay, conscious awareness. You know, someone call to you and speak your name and you can hear it. Okay, and you can see towards the person who call you. Okay, and this is the example of the visual conscious. You are conscious for hearing also and for visual also. This is the primary visual cortex. Okay, number 1. Number 2, which is in parrot color, number 2 area, this area is visual association cortex. Okay, visual association cortex. Okay, I give you some example related to these two areas. there is only present, these two areas are present in the occipital lobe related to visual stimuli. Okay, the first one is primary visual cortex, second one in visual association cortex. Okay, I give you some example. For example, this is the ball. Okay, I see the ball. Okay, this is controlled by which area of the brain? So the first one area is primary visual cortex. Primary visual cortex control the visual stimuli. Okay, this, I see this ball. Okay, this is a ball. I know this is a ball, but only first area recognize this is something like a ball. Okay, but I don't know this is a ball. But the second area control the information about awareness. Okay, about an meaning, what are the meaning of this visual stimuli, how I recognize this visual stimuli. Okay, so this is a ball. For example, I give you example. This is a ball. Okay, I see this is a body, like this is a mass. Okay, this is controlled by first area. Okay, and the second area, which is visual association cortex, I know the ball size, the ball color, and the ball shape. Okay, is it move or not, like this type of visual stimuli is controlled by the second area, which is the visual association cortex. Okay, so these are all two areas of the brain related to the occipital lobe. So guys, in previous videos, first I talk about the frontal lobe, then parietal, then temporal, and today's my topic is about the occipital lobe. And I tell you one more lobe in the brain, which is the insula, which is also present deep in the temporal lobe. Okay, deep in the temporal lobe. So I explain with the temporal lobe. So today's my topic is about this area. I tell you the boundaries. I tell you the boundaries of this area, occipital lobe, functional anatomy of this area. Okay, and give you example, okay, of this area. So guys, please make the notes compulsory, and clear the concepts related to the functional anatomy of the brain. Okay, in my next video I explain the general view of the all the lobes of the brain. Okay, I draw the brain and I label the functional anatomy. Okay, and related to the functional anatomy, I cover the clinical importance of it. Okay, clinical importance. If this part is damaged, what happen? If this part is damaged, what happen? Okay, so like clinical correlation with the functional anatomy. Okay guys, so guys, please watch my video and like, share, and subscribe my channel, and also write in comment about my video, ask any question related to my video. I give you more elaboration and I explain to you more detail. Okay, so guys, be happy, goodbye, take care.